Welcome to a new episode of the Clinical Guidelines in Primary Care podcast. My name is Fernando Florido and I am a GP in the United Kingdom. This is the third episode of the Cancer Guidelines series and is the last one reviewing the section Recommendations by Site of Cancer of the NICE Guideline NG12 Suspected Cancer Recognition and Referral. In this podcast, I will cover a large number of areas, including skin cancer, head and neck cancers, haematological cancers, nervous system cancers, sarcoma, and childhood cancers, as well as other non-site specific symptoms of concern. I hope that you enjoy the episode. We will start with skin cancers, and the first ones to consider will be malignant melanoma and squamous cell carcinoma of the skin. For these, we need to consider a cancer referral for melanoma in people with a pigmented or non-pigmented skin lesion that suggests clinically the possibility of nodular melanoma or squamous cell carcinoma, and this includes the use of dermoscopy. We must also refer people using its suspected cancer pathway referral to exclude melanoma if they have a suspicious pigmented skin lesion with a weighted 7-point checklist score of 3. Now let's go quickly through the weighted 7-point checklist, which lists major features of the lesions, which score 2 points each, and that's change in size, irregular shape, irregular color. And minor feature of the lesions, scoring 1 point each, which is larger diameter of 7 millimeters or more, inflammation, oozing, or change in sensation. So if the sum of those features is 3 or more, then we must refer using a cancer pathway. So major features scoring 2 points each, change in size, irregular shape, irregular color. Minor features scoring 1 point each is diameter 7 millimeters or more, inflammation, oozing, change in sensation. Now, in respect of basal cell carcinomas, we should only consider a suspected cancer pathway referral if there is a particular concern that a delay may have a significant impact because of factors such as lesion site or size. Otherwise, it should always be a routine referral. Now we're now going to move to head and neck cancers, and the first one to look at is laryngeal cancer. And for this, we need to consider a suspected cancer pathway referral in people aged 45 and over with persistent unexplained hoarseness or an unexplained lump in the neck. Now for oral cancers, we need to consider a suspected cancer pathway referral in people with either an unexplained ulceration in the oral cavity lasting for more than 3 weeks or a persistent and unexplained lump in the neck. We also need to consider an urgent referral to a dentist for an appointment within 2 weeks for assessment of possible oral cancer in people who have either a lump on the lip or in the oral cavity or a red or red and white patch in the oral cavity consistent with erythroplakia or erythroleukoplakia. Then the dentist will decide whether these patients get referred through a full suspected cancer pathway referral. So we refer the patient directly if there's unexplained ulceration in the oral cavity for more than 3 weeks or a persistent lump in the neck. Otherwise, we refer urgently to a dentist for a lump in the lip or oral cavity, which is not ulcerated, or there is erythroplakia or erythroleukoplakia, and then the dentist will decide whether that patient needs further referral. For thyroid cancers, we need to consider a cancer referral in people with an unexplained thyroid lump. That's fairly straightforward. The next section is brain and central nervous system cancers, and the recommendations are different depending if the suspicion refers to adults or children and young people. In adults, we need to consider an urgent direct access MRI scan of the brain, or a CT scan if the MRI is contraindicated, to be done within 2 weeks in adults with a progressive subacute loss of central neurological function. That is to be done within 2 weeks if there is progressive subacute loss of central neurological function. That is to be done within 2 weeks if there is progressive subacute loss of central neurological function. However, in children and young people, we need to consider a very urgent referral, which means an appointment within 48 hours, in children and young people with newly abnormal cerebellar or other central neurological function. This is straightforward and simple, to be seen within 48 hours if there is newly abnormal cerebellar or other central neurological function. Now we will now look at the hematological cancers, and for leukemia in adults, we need to consider a very urgent full blood count, which is to be done within 48 hours for any of the following: pallor, persistent fatigue, unexplained fever, unexplained persistent or recurrent infection, generalized lymphadenopathy, unexplained bruising, unexplained bleeding, unexplained petechia, or hepatosplenomegaly. So to say this again, do a full blood count within 48 hours if there is pallor, persistent fatigue, unexplained fever, unexplained persistent or recurrent infection, generalized lymphadenopathy, unexplained bruising, unexplained bleeding, unexplained petechia, or hepatosplenomegaly. Now, in terms of leukemia in children and young people, firstly we need to refer children and young people for immediate specialist assessment for leukemia if they have unexplained petechia or hepatosplenomegaly. So that is immediate referral to a specialist for leukemia if they have unexplained petechia or hepatosplenomegaly. Also, similar to adults, we must offer a very urgent full blood count within 48 hours in children and young people with any of the following symptoms. And again, we're looking at pallor, fatigue, fever, unexplained persistent infection, generalized lymphadenopathy, persistent or unexplained bone pain, unexplained bruising, or unexplained bleeding. Now the next cancer is myeloma, and for this we need to offer a full blood count and a blood test for calcium and plasma viscosity or erythrocyte sedimentation rate, or ESR, in people aged 60 and over with persistent bone pain, particularly back pain or unexplained fracture. So that is a full blood count, blood test for calcium, plasma viscosity and ESR if they're 60 and over with bone pain, especially back pain or unexplained fracture. And then we need to offer a very urgent protein electrophoresis and a Bence-Jones protein urine test, that is within 48 hours, in people aged 60 and over with hypercalcemia or leukopenia of the ESR or plasma viscosity are abnormal and the presentation is consistent with possible myeloma. Obviously, we will refer people using a suspected cancer pathway if the results of protein electrophoresis or a Bence-Jones protein urine test suggest myeloma. So we first do the full blood count, calcium, ESR and viscosity. If they are abnormal or suggestive of a possible myeloma, then we do urgent protein electrophoresis and a Bence-Jones urine protein. And if they're abnormal, then we do the suspected cancer pathway referral. Now finally, the recommendations are the same for Hodgkin's and non-Hodgkin's lymphoma, but separate recommendations have been made for adults and for children and young people to reflect that there are different referral pathways. Now for adults, We need to consider a suspected cancer pathway referral in adults presenting with unexplained lymphadenopathy or splenomegaly. When considering the referral, we will take into account any associated symptoms, particularly fever, night sweats, shortness of breath, pruritus, or weight loss, or in the case of Hodgkin's lymphoma, if there is alcohol-induced lymph node pain. For children and young people, we need to consider a very urgent referral, that is for an appointment within 48 hours, for specialist assessment in children and young people presenting with unexplained lymphadenopathy or splenomegaly. Equally, when considering the referral, we will take into account any associated symptoms, particularly fever, night sweats, shortness of breath, pruritus, or weight loss. So the moral is the same, it's just that for adults, we refer for a suspected cancer pathway within 2 weeks. For children, it will be within 48 hours. We will start with sarcomas, and separate recommendations have been made for adults and for children and young people to reflect that there are different referral pathways. In terms of bone sarcoma in adults, we need to consider a suspected cancer pathway referral for adults if an X-ray suggests the possibility of bone sarcoma. That is fairly straightforward. Now, for bone sarcoma in children and young people, we need to consider a very urgent direct access X-ray to be done within 48 hours in children and young people with unexplained bone swelling or pain. And then we need to consider a very urgent referral for an appointment within 48 hours for specialist assessment if an X-ray suggests the possibility of bone sarcoma. Now, in respect of soft tissue sarcoma in adults, we need to consider an urgent direct access ultrasound scan to be done within 2 weeks in adults with an unexplained lump that is increasing in size. And then we need to consider a suspected cancer pathway referral, also for an appointment within 2 weeks, for adults if they have ultrasound scan findings that are suggestive of soft tissue sarcoma, or if ultrasound findings are uncertain and clinical concern persists. Now, for soft tissue sarcoma in children and young people, the recommendations are exactly the same as for adults, with the exception of where we said to be done or seen within 2 weeks, it is now 48 hours. So for children, we need to consider a very urgent direct access ultrasound scan to be done within 48 hours to assess for soft tissue sarcoma in children and young people with an unexplained lump that increases in size. And then we need to consider a very urgent referral, and that is for an appointment within 48 hours for children and young people if they have ultrasound scan findings that are suggestive of soft tissue sarcoma, or if ultrasound findings are uncertain and clinical concern persists. Now we're now going to look at 3 types of childhood cancers, and the first one is neuroblastoma. For this, we need to consider very urgent referral, that is for an appointment within 48 hours, for specialist assessment for neuroblastoma in children with a palpable abdominal mass or unexplained enlarged abdominal organ. For retinoblastoma, we need to consider urgent referral for an appointment within 2 weeks for ophthalmological assessment for retinoblastoma in children with an absent red reflex. And for Wilms tumor, we need to consider a very urgent referral for an appointment within 48 hours for specialist assessment in children with any of the following: a palpable abdominal mass, an unexplained enlarged abdominal organ, or unexplained visible hematuria. Finally, for non-site specific cancer symptoms, we need to say that some symptoms or symptom combinations may be features of several different cancers. For some of these symptoms, the risk for each individual cancer may be low, but the total risk of cancer of any type may be higher. This section includes recommendations for these symptoms. Firstly, we need to look at symptoms of concern in children and young people. We need to consider referral for children if the parent or carer has persistent concern or anxiety about the child's symptoms, even if the symptoms are most likely to have a benign cause. Lastly, in respect of symptoms of concern in adults, we will say the following. For people with either unexplained weight loss, unexplained appetite loss, and deep vein thrombosis, all of which can be a symptom of several cancers, we must carry out an assessment for additional symptoms, signs, and findings that may help clarify which cancer is most likely, and then offer urgent investigation or a suspected cancer pathway referral depending on our clinical judgment. And that would be for people with either unexplained weight loss, unexplained appetite loss, and deep vein thrombosis. This is the end of this episode of the Clinical Guidelines in Primary Care podcast. I hope that you have enjoyed this episode, and I hope that you will join me in the next one. Thank you for listening. Goodbye.